How to recognise a stroke, a short guide for LINC volunteers. Welcome to the LINC Visiting Scheme bite-sized talk on how to recognise a stroke. In this short webinar, we shall be looking at what a stroke is, how to recognise a stroke, and what to do if you suspect someone has had a stroke. Strokes are very common in the UK. The latest statistics from the Stroke Association indicates that one person has a stroke every 5 minutes. This results in 100,000 people having strokes every year. A stroke is potentially life-threatening and is always a medical emergency, so knowing how to recognise one and what to do could potentially save someone's life. A stroke is caused by a disruption to the blood flow in the brain. This starves the brain of the vital oxygen it needs. The disturbance of the blood flow can be caused by either a clot or a bleed inside the brain. Strokes can affect people in many different ways, depending on where in the brain the blood clot or the bleed occurs. Strokes can happen to people of any age, but are most common in the age group that we support and work with, the older adults. A stroke is always a medical emergency. In order to give a person the best possible outcome, we need to act fast. FAST is a well-known acronym that you may have seen on TV adverts, which serves as a reminder of the signs of a stroke and what we need to do. F is for face. Look at the person's face. Is it symmetrical, or is it lopsided or drooping on one side? If it's not obvious, then ask the person to smile, as it might then be easier to observe facial weakness. A is for arms. Ask the person to raise both their arms to shoulder height and keep them there for 2 to 3 seconds. If a person has had a stroke, they may not be able to raise their weakened arm or to hold it in position. If the person is unable in normal circumstances to raise their arms to shoulder height, then ask them to squeeze both of your hands as tightly as they can. If they've had a stroke, they may have a markedly weaker grip on one side of their body. S is for speech. This might be the only way you can pick up that a person may have had a stroke if you're speaking to them on the phone. Someone who's had a stroke may have slurred speech, or their speech may be confused, repetitive or jumbled, or perhaps they may give you inappropriate answers to questions you ask them. It's important to remember that even if a person has just one of the signs, a weakness in their face or arms or changes to their speech, they may still be having a stroke. T is for time. So if one or more of the signs are present, it's time to call an ambulance as soon as possible. Making a 999 call. Dial 999 and ask for the ambulance service. Say you suspect the person has had or is having a stroke. You will be asked for the address that you're at and the approximate age of the casualty. Whilst waiting for the ambulance, it's important to keep the person comfortable. You may want to put a blanket around them and prop their weaker side up with cushions or pillows. The person who's had a stroke needs lots of reassurance. They'll need to know that they're safe, that you will stay with them, and that an ambulance is on its way. It's very important not to give the person anything to eat or drink. They may not be able to swallow because of their stroke, and it's possible they'll need an operation with an anaesthetic when they get to hospital. A TIA is sometimes referred to as a mini stroke. In the acronym TIA, T stands for transient, meaning it comes and goes. I for ischemic means it relates to the blood flow, and the A stands for attack. A TIA can present exactly like a stroke, but only lasts for a short period of time. The person may appear to go blank for a few seconds, or present with weakness in their face or arms, or altered speech. However, they quickly then return to normal. TIAs are often a warning sign that a stroke is then likely to happen soon. Since early treatment could prevent this from happening, if you suspect a TIA, call 999 for an ambulance as soon as possible. If you do ever need to call an ambulance for a Link friend, please remember to call the Link office to pass on this information and to receive support and assistance from our staff. Thank you for listening to this presentation. If you have any questions, please do contact the Link office.